Okay, so now we're going to talk about manual traction and its advantages. So, no equipment necessary, just need our hands and our body, right? Minimal setup. The force is controlled by the therapist. We can improve the isolation of the segment as long as we know our anatomy. Monitor the response as we go so I can adjust as I'm working with a patient. And I also use this a lot to test whether mechanical traction is indicated. So if they get relief from my doing the manual traction, I feel they're going to be a good candidate for mechanical traction. If it increases their symptoms, then I maybe am going to try something different. So it really is a good assessment tool as to whether you want to use mechanical. The disadvantages, duration limited by the strength and endurance of the therapist, difficult to reproduce between clinicians and sessions, and can be difficult on the therapist's body. So here she's up on there, she's using good body mechanics and she's pulling to get some distraction of the lumbar spine. It's really comfortable for the patient. They love this. But again, as a therapist, you can only do that for so long. So it's just a matter of your strength and endurance. And so here's just a couple of different options that we've kind of gone over in ortho a little bit, but we'll go over them again here in lab on Monday, and then again in ortho. We'll do that when we get to the spinal section. So here he's using a belt, so that's going to help his body a little bit more. You just have to be careful of the angle, so you want to raise the table to where it's effective and you're getting the pull that your patient wants. This is a single leg one, so they've isolated out, stabilized his pelvis, and then he's just doing a single leg. This person probably just has symptoms on one side, and so that's why they're doing more of a long axis on the one leg. I can also do a bilateral one with a patient, and I'll just kind of, a lot of times I'll put it so that my back is to the wall and I can lean against that wall and hold either one leg or both legs and last a lot longer that way. Here's ones for the cervical spine. So here I'm using my belt to kind of help me, and we'll kind of talk about that. And he's just kind of holding him, putting a little bit of gap. So right now, the way he's got his spine barely out of neutral, this is kind of working more the upper cervical spine. Here is in a little bit more flexion, so we're getting down more into the lower cervical spine. Here's just in a sitting position doing some straight up distraction for somebody. And that's it. Thank you.